So what is the important information for a patient when it comes to deriving data or glean data from his or her oncologist, from precision medicine approaches? I think the first and most important information a patient can get from their oncologist is an understanding of what are the most dominant mutations active in a patient's tumour at any one time. So in other words, it's moving away from is the mutation in a gene there, yes or no, to is that mutation present in all my cancer cells, doctor? And having some understanding of that. And that really is at sort of the cutting edge of where we are at precision medicine at the moment, because we're only just as doctors beginning to understand what mutations are in all the cells and which mutations are in some cells. So, and yet we also don't know whether targeting tumours, the trunk of the tumour if you like, is the right approach. But it would stand to reason that to maximise tumour response, you would want to target a mutation that is present in every tumour cell, at least as the most parsimonious route, if you like, to annihilate or restrict the growth of the entire tumour. So that would be the first question I would ask my oncologist. The second question I would ask my oncologist, particularly if I was a young patient, is there any information in that precision medicine approach that you've taken that might inform about familial risk of my daughter or my son having a similar cancer to me? Now, many of the approaches we're taking in the clinic don't give us that information because we're not sequencing germline DNA, that is DNA that derives from the patient's normal tissue. But increasingly, as our precision medicine approaches develop and get more complex, germline DNA sequencing will likely be part of that approach and will be part of the sort of risk stratification approach that will be discussed in the consultation with the patient. What would a patient ask in the face of precision medicine in this era of very exciting cancer genome biology that is informing patient care at an unprecedented rate? I think is an excellent question. And it always amazes me how altruistic patients are. Patients genuinely want to help and further the understanding of the disease. And patients often ask me this question, and I talk to them very frankly about what they can do. And I think, you know, one thing a patient can do is insist that their tumours are biobanked for future research and seek IRB, ethics-approved protocols for them to sign up to allow their tumours to be distributed to interested research groups. But there's also a very important aspect to all of this, that's something that mankind has really got to understand and something we know very, very little about, and it's a very sensitive and very difficult issue to discuss. And it's one I would only discuss after, you know, patients were certain they wanted to really discuss this with me. And that's one of understanding a cancer or patient's cancer at around about the time of death. And that's obviously difficult to discuss, and it's a subject that I don't enjoy discussing, but it's a very important discussion if we're ever going to fully understand how cancers change over time and how cancers ultimately result in the very tragic demise of the patients that we serve and care for. And that discussion centres around the need for what essentially are autopsy studies, so the studies of tumours after death. And the simple fact of the matter is, and simple reason for that, the necessity, is that we don't understand the relationships between tumours at different sites of disease. So tumours have metastasized to spread to different sites, bone, liver, lung, brain, tragically. But we have no idea, or very little idea, about the relationships of those specific tumour sites to each other and how we could develop better approaches to stop those metastases or those cancers from spreading to those sites in the first place. And it's going to be through those very deep genomic studies in relatively large numbers of patients that are going to inform, I think, the next steps of cancer care, which are going to be preventing metastatic spread to those sites of disease.